Okay, so I said I was studying this maternity, and we are coming to do ops and gynae, more of ops and gynae, and we are coming to start from the basis. We'll build on the basis what we expect to know, and then from there we'll go more into the various when it comes to maternity and labor. It will be more of labor related issues, okay, so that we refresh our memory on that and what's the NCLEX when it comes to labor, and then maternity in general, what we expect, okay. So first of all, we have to understand, I know these are the basics, like I said. So when it comes to the basics, everybody will be able to get it, and it's not difficult. So we'll start from how to determine the estimated date of delivery using a very simple rule or using a very simple formula. And then when we are done, we look at signs of pregnancy. Okay, signs of pregnancy in quotes. And then in the NCLEX, we'll be looking at when it comes to the science of pregnancy, what are we talking about? Because the NCLEX has what you call an interest areas, especially how to group the signs. Okay, the signs are grouped in three phases or in three stages: the presumptive sign, probable signs, and then positive pregnancy signs. And so, or positive signs of pregnancy. So we'll look at all these, and then when we are done, we'll look into other things as well. So first is determining what you call the date of delivery, the estimated date of delivery of a pregnant woman. And so if someone is pregnant and then you have a question that says that Madam A reported to the emergency ward, and then after assessment, patient told you that her last menstrual period was, we are in May, so let me use February, February 10th. Her last menstrual period was on February 10th, and then since then she hasn't had her cycle again. And they ask you to determine the estimated date of delivery of that woman. Let's say after labs and everything, it was noted that the patient is pregnant, and they are asking you in the first question, what is the estimated date of delivery for that woman? Let's say you have a case study. They've described a pregnant, everything, assessment findings, nurses note everything, telling you that this is, a pregnant woman you have met. And then the first question is determine the estimated date of delivery. Okay. And so how do you go about it? Is it now that you are coming to take your hand and start counting, and then so you find it difficult, okay, if you don't know this. So what we need to understand is that when it comes to determine the estimated date of delivery or the date of birth, we use a rule, we use a formula, and this formula is widely accepted. Okay. And so the formula is Nigel's or Nigelis rule, however you want to pronounce the name. I'm sure this is the name of the person who first discovered this rule or who first used it. And so we are using the Nigelis rule, which requires that for someone, for you to be able to use this, okay, to determine someone's estimated date of delivery, the individual should have what you call a regular menstrual cycle. And we know what a regular menstrual cycle is, okay? And so a 28-day, menstrual cycle for you to get a perfect or accurate what you call measurement. But almost all of it, the question might not even tell you whether it's the person is having a normal menstrual cycle, but it will just ask you to determine the AED. Some of them will state, but regardless of whether they state or not, the rule still applies. And so, what you need to understand when it comes to the rule is that the first thing is to subtract 3 months. Okay, first subtract 3 months. Okay, from first subtract 3 months and add 7 days to the first day of the last menstrual cycle. This is where the trick comes. Okay, so the thing is that first subtract 3 months and add 7 days to the first day of the last menstrual period, and then add 1 year if appropriate. Alternatively, you can add seven days to the first day of the last menstrual cycle, and then you count 9 months forward. So any of them you can use. You can use the first method where you subtract 3 months and then you add 7 days to the first day of the last menstrual period. Then, or you can go with what you call adding 7 days to the first day of the last menstrual period, and then you count 9 months forward. So any of it, if any one of these you feel comfortable with, you can use. Now, this is what I want you to take note of. Adding 7 days to the first day of the last menstrual period. That is the interest area. Mostly that is where the trick is. It says that add 7 days to the first day of the last menstrual period. It is not, it didn't say that add 7 days to the person's the date that the menses ended. And so let me give you an example. For instance, if you have someone whose last menstrual period was started on, let's say, started on 10th April. Let me use 10th April and then ended on 15th April. Okay, because that is the individual's normal menstrual cycle. It started on 10th April and then ended on what we call 15th April. And they are asking you to determine the estimated date of delivery for this individual. What then do you do? The rule is that subtract 7 days from the first day of the last menstrual period. Remember, the menstrual period lasted for 5 days. It started on the 10th and ended on the 15th. And so when you are determining which of the dates you are going to use, are you going to use the 10th or are you going to use the 15th? The rule says that use the first day of the last menstrual period. So the first day of the last menstrual period was what? Was 10th April. So you use the 10th April and then you add 7 days to the 10th April. So April 10 or 10 plus 7, you are getting 17th. You are getting 17th. Okay. So you are getting 17th. Then you either count 9 months forward or you subtract what you call 3 months. Okay. You subtract 3 months from that and then you add 1 year if appropriate. Now let me give you an example. Sometimes you would have to stick with one. Either you are counting the 9 months forward after adding your 7 days, or you decide to subtract 7 days and then add 1 year to it if appropriate. Okay. Now let me give you an example. Let's still stick with the example I gave using what you call the April 10th. Okay. And so let's say that the patients came with what you call a history that says that her last menstrual period started from 10th April. And so 10th April, we are using 10/04/26. And then it ended on 15/04/26. And we had to determine the estimated date of delivery for this patient or this person. And so we said that to determine it, add 7 days to the first day of the last menstrual period. And so the 7 days will be added to this date, not the second one, because the first one is the first day of the last menstrual period. And so we are having 17. So now it will be 17th April 2026. Then one of the rules is that you count what we call 9 months forward. So you can decide to add 9 months to this one. And 9 plus what do you call 4? What do we get? 9 plus 4 is 13. So it means that you are going to enter the following month. Then, so that will take you to the following month, right? Or the following year. So you are going to get 17th January 2027. Okay. Or you can decide to use what you call the first rule, which is after adding what you call the 7 days, you subtract 3 months from what you call April. And so you are going to get 17th January 2026. Then it says that add 1 year to it if appropriate. So in this case, you would have to add 1 year to the 26th, and then you get what you call 27. So that will give you 17th January 2027. So you realize that both of it is giving you the same answer. So when you use the first one, when you use the first scenario, you have to add 1 year to what you call the year. In quotes, if appropriate, you have to check to see if there's a need for you to add. If you are using the second rule where you have to count 9 months, that one you don't need to add, because after adding, if it exceeds the year, it means automatically you will enter the new year, which is the year ahead. Okay. All right. I have a hand up. Let me see if probably maybe. Yes. So, Bibi, your hand is up.
Yes, I mean, good morning. Hey,
Yeah.
good afternoon. Sorry.
Don't worry.
I wanted
Go
I
ahead
wanted to make
at
an
your end.
input.
Okay.
So in the US, the way they write their dates, I think that is why they made that rule. In writing their dates, the month comes first before the day, then the year. So
Mhm.
their month comes first. So today being 8 is 5/8/2026. Instead
Mhm.
of in Ghana, we write the day first before the
Mhm.
month. So
Mhm.
if we are able to establish that fact, we write
Mhm.
the month first, then we
Mhm.
write the day, then we can add our the addition that we want to do.
Mhm.
Uh-huh. I don't know
Oh,
if you get my point.
okay, so I'm getting your point. Your point has to do with the arrangement of the dates, right?
Yes, yes. So you
Ah,
don't get confused here.
okay, okay. But when it comes to, yes, I am using numbers here, but when it comes to the NK, they will definitely use the June, they will write the actual month in words so that you don't get confused. Okay. So that you don't get to start thinking about which of the arrangements are they using. Are they using the month first before the day, and then the year follows, or which of them, so you don't get confused. So I think
Okay,
almost all
okay,
the questions I've had,
okay,
they use what do you call, the month is written in what you call words, so that you can distinguish between what they actually trying to tell you. Okay. Okay. Thank you. Because sometimes it's very confusing, especially if you have been doing these registrations regarding US. They like using months first before the year. Sorry, before the day, then the year will follow. But I want to find out what we did, whether you guys understand what I just said. Okay. So if you have any question on what I just said, so it says that add 7 days to the first day of the last menstrual period. After that, you can decide to count 9 months forward. Then you will get the dates. Or you can decide to go with this, where you have to, after adding your 7 days to the first day of the last menstrual period, you then, what do you call subtract 3 months from the month, and then you add a year to it if it's applicable, or if you need to add the year. Is there any question, any input on how to determine the EED? It is very simple, and so anywhere I have done this, I don't tend to get issues. People tend to want to ask so that for better understanding. Say, so if you are here and then you also want any kind of clarification, you can bring it up before I go to the next thing. Okay, so our next thing we'll talk about is on how to determine, how to explain this. Okay, when you are giving these acronyms with numbers tied to it. So we are coming to look at gravidity and parity in terms of the acronyms and then what is involved. So let's say you get a question and then with GTPAA. So let's say you have this, let me, you have, I want to write on my screen. Sorry, I want to write. So you have a question, and the question is giving us let's say G3, T, let's say 1, you have P1, you have A0, and then L2, and they are asking you to, explain what is in front of you or what this represents. Okay. Now, what it means is that a patient's, what you call pregnancy history, has been represented in this form. And what you have to do is to explain it. Okay. And so that is what we are coming to do. So gravidity and parity determines the number of days that, or the number of times, sorry, the number of times that a woman has had been pregnant or had become pregnant. And then the parity. When we talk about parity means the number of pregnancies that an individual has carried beyond 20 weeks of gestation. Okay, beyond the week of viability. So we say that a fetus is viable when the fetus is beyond 20 weeks. That is why when you give birth and then you give birth before 20 weeks, we term it as either miscarriage or abortion, because before 20 weeks, the fetus isn't viable and cannot, what do you call, it's not viable. Okay. And so the fetus is not viable before 20 weeks. But after 20 weeks of gestation, whether you intentionally lost the pregnancy or you give birth after 20 weeks. Okay. After 20 weeks, the fetus become viable. So it is either preterm, yes, after 20 weeks. If it's after 20 weeks and you are giving birth, that is when we term that pregnancy as, being viable. And so that is why you can have someone who has had, let's say you pick someone's book and then there is something like G2, P0, and the person isn't pregnant and the person's medical record has G2, P0. What it means is that the person has had two previous pregnancies or the person had carried two pregnancies, but none of the pregnancies has been carried beyond what you call 20 weeks of gestation. If you are having this in someone's book, that is the meaning of this. It means that an individual has had two pregnancies in her lifetime, but among those two pregnancies, none of them has been carried beyond what we call 20 weeks gestation. I hope you are getting me. And so gravidity talks about the number of pregnancies, including the current, what we call pregnancy. Okay, kindly mute her for us. City, kindly mute her for us. Kindly mute her for us. I'm sure she just joined. Let me mute her. Okay. When you join, kindly mute her. So I was explaining what gravidity is. So gravidity, the number of pregnancies, including the current, what you call the current one, or including the current pregnancy. And so when you go to the ANC, or when you go to the maternity and someone is pregnant and you see in the book that the person is having G2, that means that the person has had two pregnancies including the current one. So that means that there is a previous one and the current one. That is why the person is having G2. And then P0, it means that the current pregnancy probably might have not gone beyond what you call 20 weeks. And then the one that's the previous one might have also not did not also cross 20 weeks. That is why you might see someone and then the parity will be what you call zero. And then probably maybe the G is more than either zero or one or two. Okay. I hope that makes sense. So parity, I state again, parity talks about the number of pregnancies that has been carried beyond the week of viability, which is which is after 20 weeks of gestation. Okay. Then we have T. So the T talks about term. Okay. Term is the total number of um births that had been born at term gestation. And at term gestation, we mean 37 weeks. After 37 weeks, okay, any birth that occurs after 37 weeks is termed as a term gestation. So, for instance, I have an example here. When we finish, we try looking at an example. I also have an example in my question. Then we have preterm. So this P in a standard GTPAL, look at how the arrangement has been made. In some of the books, you will see this parity included. So if the parity is included, you see the parity just after the G. Okay, so in some books, you see it as GP, then you have TPAL. Some of the Q banks or some of the books will include the parity. Okay, but if you don't see the GPTPAL and it is GTPAL, what it means is that they haven't included the number of parity. Okay, the P you are seeing over here is preterm. Okay, that is preterm birth. The number of birth that has occurred after 20 weeks of gestation, but before what we call 37. So between 20 weeks, listen to me, between 20 weeks and then 37 weeks, any birth that occur within that range is termed as a preterm. Between 20 weeks up until 37, anything that happens between that duration is termed as a preterm birth. Okay, so preterm is the number of born before 37 weeks. Then the A represents abortion. And so abortion or miscarriage. So A is abortion or miscarriage. And then that accounts for the number of what you call abortion or miscarriage that occurred. And then we said that miscarriage or abortion is anything that is less than 20 weeks. And so if you have any woman who is pregnant and then the person loses the pregnancy before 20 weeks, it is counted as abortion or miscarriage, depending on the nature of what they call how the person lost the pregnancy. These are terms, okay? And so if it is intentional, abortion, if it's not intentional, it's miscarriage. But anything less than 20 weeks, you should understand that it is termed as what you call abortion or miscarriage. Then we have L. So the L, the last letter is L. And the L represents what we call the number of children currently living. And this is where sometimes it gets tricky. So L is the number of current living children. And so out of the total number of pregnancy the person has had, and out of the total number that the person had delivered, how many of them are currently living? How many of them are currently living? That is what the L represents. And so there are instances where you can get the L to be more than what you call the number of pregnancy the person has carried. Let me take it again. I'm saying that there are instances where you get a question where you have the number of children currently living being more than the number of pregnancy the person has had. And this is it. When it comes to the number of children living, if there was any multiple gestation, or if there was any multiple birth, let's say there was a twin gestation or there were triplets or quadruplets, when you are counting, we then count the children individually. So someone could have one gravidity, but when it comes to the number of children currently living, it can be more than one, it can be two or three. If it is three, it means that the person, there was a multiple gestation, or the person had what you call triplets. That is why the L could be three and then G will be one. I hope you are getting me. So L is the number of current living children. This number can be greater than the parity and that of what you call gravidity, okay, if multiples were delivered, or less than the parity if a loss occurred. So let's say the person had, let's say, two pregnancies, okay, and then all the two pregnancies were carried beyond what you call 20 weeks. And after giving birth, the person gave birth to all the two, or the two children the person gave birth. But out of the two, one of them, had died. And so when you come to the number of living, you realize that the living will drop by one, but that of the G will be more than what you call the L. I hope you are getting me. So if it is gravidity, we don't separate and count. And so, for instance, if someone is, pregnant, and then it has been determined that it is multiple gestation, we don't see that because the person is pregnant and then it is noted to be what we call multiple gestation, we will divide, the multiple gestation and count gravidity as two. No. Regardless of the number of children the person is expected to give birth to, gravidity always remains one. The same as parity. Parity also still remains at one, regardless of the number of children that the person is expected to give birth to. And then the same thing applies to preterm and then abortion. It is only the living that when it is multiple gestation, you count the children separately and put the actual number there. Okay. So let's look at what I wrote on the screen. So I wrote G3, T1, P1, A0, and then L2. So what is the meaning of this? What it means is that this patient had three pregnancies, including the current one. Okay, so three pregnancies. Out of the three pregnancies, one was delivered after 37 weeks of gestation. That is why you have T1. Then you have P1. So I said that this P represents what we call preterm. And so we said that preterm birth is any birth between 20 weeks of gestation and then 37, between 20 and 37. If someone give birth within that week duration, it is termed as what they call preterm. The person had not had any abortion or any miscarriage. That is why A is 0. And then the L is 2. When you add the number of term children and then preterm, you realize that you are going to get 2. And so that is why L is 2. So telling you that the person is having two children who are currently there, or two living children. I hope it makes sense. Is there any question, any input, any issue here?
Please, does it mean that the woman is
Mm.
currently pregnant?
Yes, kindly. Yes.
Okay, because the G is
Hello.
three.
I
Yeah, I
heard a
was
voice.
asking.
Yes, Mr. Wilson, can you raise up your voice more?
Yeah, I was asking that once the listen the G is three, and then the total number of children, living children, is two. It means that she's currently pregnant.
Yes, she's currently pregnant. That is why the G is 3.
Okay, okay.
So, but Amingo,
Yes.
hello.
Yes.
So when would we see whether the P is parity, and when would we see whether the P is preterm?
So I told you that if it is parity. It will come
Mm.
after what you call the G.
Oh, okay, right after the G.
Yes. But
Oh, okay.
mostly,
But if it's
yes, and mostly to the term, if they will bring the parity, they will definitely bring the preterm aspect. And so it is either you are seeing, if they will include the parity, it will be just after what you call the gravidity. Okay, then you have your T here, and then you have your P here, A here, and then L. So this is where they are including what you call parity.
oh, okay. Okay. Thank you.
Yes. But under normal circumstance, if you don't see what you call the P there, and you have only this P between the T and the A, this P is representing what you call preterm.
Okay. Okay. Thank you.
All right. Any question, any inputs? Okay, so let's go. These are the bases. So then we
Hello,
come,
sir.
yes, hello.
Sir, please. So, please, oh, if I got you right, maybe
Mm-hmm.
like um 4 pregnancies,
Mm-hmm.
but the person haven't had any preterm,
Mm-hmm.
but maybe 2 miscarriages,
Mm-hmm.
but have one child
Mm-hmm. Living.
living.
Uh-huh.
So
So
which
let me try to
is this?
represent, let me try to represent what you are saying in the chat form.
Mm,
So you are saying that the person had 4 pregnancy.
yes, please.
The person, so we are continue. Then you said the person, so we said GT,
Yes,
no
please.
abortion or miscarriage, right?
Yes, please.
Um, okay, I want to write it. I want to represent that here. So let me come. I want to understand it well. So now, this is, we want to represent what you are saying here. So G means the total number of pregnancy, which is 4,
Oh,
including the current one, if the person is pregnant. Then you
yes,
said the
please.
person has not had any abortion or miscarriage, so A will be
Yes,
0.
please.
Okay.
Yes,
Then
please.
you said how many are living?
2.
So 2 will be living. And then
Yes. And there
so
is no preterm.
there is no preterm.
Yes.
Uh-huh.
And 2 term.
Into term.
Yeah.
Uh-huh. Is a
Oh,
person
okay.
is a person is a person pregnant at the moment?
Yes, please.
The person is pregnant. And
Yes,
so
please.
if the person is pregnant, okay, assuming the person is pregnant, it means that the total number here is not up. It means that something is wrong with your question, because if you sum, at the end of the day, if you sum the current pregnancy together with all these numbers, it must add up to the total number of pregnancy the person has had. So based on
Oh,
what,
okay.
so based on what you are telling me, if the person is having 2 children living, it means that one of the pregnancy, either the person lost the pregnancy, okay, or one of the
Oh,
children
okay.
had died, because
Oh, okay.
I mean, we should either get L to be 3 if there was no preterm and there was no abortion, to sum up to the current pregnancy to get 4. Are you getting the point I'm making?
Yes, please.
So it is either what you call this end, maybe preterm is 1. So
Preterm
when
or abortion.
uh-huh. So if
Okay.
if preterm is 1, what it means is that when you add this one to this, you get 3 plus the current one.
1, making
One
4.
which will give you 4.
Okay.
I hope you are getting me.
Yes, please.
Mhm.
Please, would you
Thank you.
say hello?
Yes, madam, I'm with you.
Please, with this same scenario, and let's say the person have four pregnancies, two term, and no preterm, no abortion, and two are living, and one is dead. How are you going to write that one?
Come again. Come again.
Talking about this same scenario
Mm-hmm,
without
mm-hmm.
the preterm, and let's say
Uh-huh.
one child is dead. How are you going to write that one too? Why are you going
One
to
ch
place dead
he
child?
said one child is what?
Dead.
Dead.
Yeah.
And so the living is still two, right?
Yes. Yeah.
And then time is two.
Yes.
Uh-huh. So the death
But the
child,
person gave birth before 20 weeks. Like the child was
before
giving, yes.
20 before 20
Let's
weeks,
say
it
it
means
was
that
a term
it is
pregnancy. It was a term pregnancy. So the
uh-huh,
term,
uh-huh,
but one is not living at that moment, the woman
uh-huh,
got pregnant.
uh-huh. And then the one that is not living, what happened? Did the woman give birth to that child after
Yes.
20 weeks or
Yes.
before 20?
After.
After 20 weeks,
Yeah. She gave birth.
she gave birth.
Yeah. It wasn't
After
abortion.
20 weeks. After 20
Yes.
weeks.
Yes.
Was was it after 37 or not?
It was after 37.
It was after 37.
Yeah.
Then
But
it
the
means
child
that
is
the
dead
term
before she took
it, it
for
means
the
that the
fourth
term should
pregnancy.
be three. Are you following?
Okay.
If
Okay.
the person gave birth after 37 and then the child
Okay.
lost, it will still be counted as 10.
Okay.
Just that that very 10 child had died.
Okay.
I hope you are getting me.
Yeah, I now understand.
So it means that now the total number of term gestation will now be
Will
three.
be
And so the
okay.
three, when you add the current pregnancy to this three, you are getting four.
Okay.
So here will be zero, here will be zero. Is it clear?
Yeah.
Okay. Is there anyone with any further question? If you have any question you want to ask, you want to bring it up, kindly feel free to ask your question so that we all break it down here for everyone to understand. Okay. Then comes, okay, let me see if
Sir,
this.
please, I have a question.
Please,
Okay.
Okay. So, sir, please, with the previous write-up that you just cleaned, you said G4, but the living is 2.
Yes.
Please explain that part a little.
G4,
Yes. And then T3. Let's use the other sister's example. It was G4, T3, P.
T3,
Yes, please.
and then P0,
Yes. A0.
A0,
Then L.
L3,
No, it was L2.
L2, sorry, L2. L2, right. And so this is what she said she wants me to go over again. So what this means is that this person, this individual, has had four pregnancy, including the current pregnancy. Okay. And then out of these four pregnancy, including the current one, the person had had the previous three pregnancy carried beyond 37 weeks of gestation. Means that this woman had delivered all the previous three after 37, which was at term gestation. She hasn't had any abortion. She hasn't had any preterm birth. Okay. But then out of those three pregnancies, the person had carried beyond 37 weeks and then delivered. Only two of them are living. Only two are living. So for you to know that one of the children had died, okay, for you to know that one of the children had died, you have to subtract these two from this three. And then you know that, okay, the person had carried three pregnancies beyond 10, but then currently two are living, meaning that along the line the person lost one of the children. Or it could be that it was during childbirth and then the child died, or the fetus, did not survive. Okay. Is there
So,
any
Mr. Amingo, with this
uh,
same explanation, that means the client is pregnant. So where would we write it? Then
where
for,
we
we will have to write then for P1, P3, P0, A0, L2, right?
no, come again. He said the person is pregnant.
The person, um, okay, wait, the person has been pregnant 4 times. That's therefore, right? And the
Including the
term,
current one.
including the current one.
Yes. So
Mm-hmm,
this four,
mm-hmm.
the current one is part of this four.
Oh, okay.
So the moment you see G, if in the question it stated that the person is currently pregnant, and then you see gravidity or you see G, understand that G includes the current pregnancy. Are,
Mm,
are you getting the point
so,
I'm making
mm,
here?
yeah, yeah. Okay,
So
so that
if
means,
if
mm-hmm,
if the question
mm-hmm,
states that the patient or the woman is pregnant currently, just
mm-hmm,
automatically know that when you are counting gravidity, the G, the whatever number is there, they are counting the current pregnancy
part,
as part
okay,
of the G. It's an
okay.
automatic thing. So far as it says that the person is currently pregnant, when you see the number that is attached to the G, just understand that the current pregnancy has been automatically been included.
Mm, well understood. Thank you.
Okay. And then another trick too. Let me also state another trick too when it comes to parity. Okay, we only determine parity after you have known the state of the pregnancy. So let me bring in another confuse. So let's say that you have someone, okay, you have someone. Let me clean this and let me use. I hope you understand what I said parity is. I said parity is the number of pregnancies that has been carried beyond what you call the week of viability, which is after 20 weeks. And so any pregnancy after 20 weeks of gestation, we we count it as we count it as parity. But technically, when you go to the word, or technically, when we are determining, until the current pregnancy state is known, we don't include it in the parity. So, for instance, you have someone with G2, P0. What did I say initially when I was using this as an example? I told you that it means that the person had had two pregnancies, including the current one, and then and none of them had been carried beyond what you call 20 weeks. But it could be that the current pregnancy, it's let's say 30 weeks of gestation. But yes, still, when they are writing, they will still write it as G2P0. Why? Because we only determine the parity after the final status of the current pregnancy is known. Are you getting the point I'm making? So
Yes,
someone
please. Mm-hmm,
someone could be having G2P0 written in
mm-hmm.
her book. The person is currently pregnant. The person had one previous pregnancy. And so you understand that the one previous pregnancy plus the current pregnancy make the gravidity two. But I said that
Domingo,
yes.
please, can we say that
He said, can we say what?
you delivered preterm or you delivered a term baby, the parity is after you have delivered? Can we say it that way?
Yes. After you have delivered, that is where we write the parity. So that's why I said that after we know the final state of that pregnancy, whether the person lost it or after the, let's say, 20 weeks, what happened? So after 20 weeks, if the person then delivers, then you see in the person book. So let's say that after the person had delivered, then you see in the book, they would then write G2 P1. What it means is that this person total pregnancy is 2. Out of the 2, one of them has been carried beyond 20 weeks. So until the status of the pregnancy is known, the parity will remain whether 0 or however it is previously before the person got pregnant with the current one. Are you following with the scenario I'm trying to paint?
So, but I mean, if the patient has been pregnant 4 times and has
Mm-hmm.
given birth 4 times,
Mm-hmm.
after 20 weeks, all of them were after 20 weeks. You are not writing the live ones, the preterm. You are just doing the G and the P. I mean, the
Okay.
WT and the parity. It will be G4, P4, right? All after
Yes,
20
so it
weeks.
will be G4, P4.
P4, okay.
Yes.
Okay, thank you.
Uh-huh. So because
Mr. Mingo,
yes, Madam B.
sorry. I think the confusion is from the Ghana, our system, how we write our gravidity and the parity. That is
Uh-huh.
why you are finding it a bit difficult writing this one.
Uh-huh.
Because in Ghana, if
Uh-huh.
if we write gravida 2 para 1, then we
Uh-huh.
will state either if it's an abortion, then we write 1A, maybe,
1A, yes. Yes.
or
Yes.
1D,
Yes.
like
Yes.
those
What
ones.
happened? What happened?
Uh-huh.
You understand. You understand. Yes.
That's why I
Yes.
need to I'm a bit
Yes.
confused.
Yes, I understand that part. Okay. That is why I'm not bothering you a lot with the parity when I was doing the GTP. Because sometimes people will be like, okay, we said that parity is after what do you call, I mean, the week of viability, which is after 20. Then what if I decide to include the current pregnancy and because I know that it's after what do you call 20 weeks. But technically when you are writing, you wait to know the final status of what you call the pregnancy, and then you then include it. Okay, so don't worry yourself a lot about this. It's very simple where you get your
What
questions.
gravida P para O? Can
Mhm.
we also write it G to C0?
You said can we write it as
G to C0. But
yes?
what
I
we
think that's what.
this one?
Uh-huh.
Can we write it like G to C0, P0, A1?
P0 A
G to T0,
uh-huh
T0, P0,
uh-huh
A1,
A1 What of L0?
L0. This
Yes, you
one
can.
with the
Yes, you can also write it. You can write it as just that I didn't want to add the other ones. I only wanted to stick to gravidity and parity.
okay.
And so I think you left with PT, that is 10. So you can decide to bring
Yeah, that
10.
was yes.
So you can decide to also represent it this way. So anyone who will see this will know that this person had 2 pregnancy, including the current one. These 2 pregnancy, none of them had been carried beyond 20 weeks. Okay, the parity, which is 0. Term is 0. And then preterm is 0. But abortion is 1. Knowing that the first pregnancy was lost before 20 weeks. And then living is 0. So these two also make same sense. And it's the same as what we just trying to establish. I hope you are getting it. Any question, any inputs, any clarification, feel free to come up with all the things you want to ask on this. Okay, let's talk about our presumptive signs and then we go on. And so when it comes to signs of pregnancy, these are the bases. These are what the NCLEX will ask you. You have your case study, and then you have the symptoms spread across, and then you have where they ask whether it is presumptive, probable, and then what do you call positive sign. I always use word. So there's this particular question in your word. They have this very question in the case study form, and you have to indicate which one is a presumptive sign, which one is a probable sign, and which one is a positive sign. Okay, so when it comes to signs of pregnancy, we are looking at what would indicate that an individual is pregnant. And so we have divided it into these three. The presumptive ones are the early signs, and the presumptive signs are more of what we call, hormonal changes that brings about them. Okay. And they are presumptive because it is the woman who is experiencing these things. It is the woman who will tell you that my cycle has stopped after, let's say, um February coming, I haven't had my cycle. And so the person tells you, you wouldn't know that the person's cycle has stopped. Okay. Then it's the person who will tell you that I'm experiencing nausea and vomiting, unless you physically see the person vomiting. Okay. And so these are signs that they are the early signs, if you want to put it, and they are what we call presumptive. Okay. They are not conclusive. It's a presume. So it gives you an idea that probably the person is pregnant. That is why it says presumptive sign. It is not conclusive. I hope you get it. So presumptive signs can also come about due to other issues. And so the person could have other medical problems causing the person to have what we call amenorrhea, right? We all know that if you have medical conditions where it affects what you call your hormonal, it causes hormonal imbalances, you could experience what we call amenorrhea. Then we have several conditions that an individual could experience nausea, vomiting. Okay, so because of that, we termed it as presumptive. Other things can bring about them, and so they are not conclusive that it is pregnancy if an individual is experiencing this. So presumptive signs, I want everybody to understand here. First is amenorrhea, when this comes about as a result of hormonal imbalances, and then nausea, vomiting, mostly as a result of elevated HCG level within the system. Breast tenderness when you are pregnant, as part of, the physiological changes, you need, the hormones that will assist with what we call breast milk production. And so there should be what we call some changes in the breast for production of breast milk in preparation of the child. And so there is what we call breast tenderness, tingling sensation, and feeling of fullness in the breast and all that. Okay, that could be described for you to know. Then there is what we call urinary frequency. So the urinary frequency in pregnancy, we know it is predominantly common in the first trimester and then the third trimester. Okay, second trimester, urinary frequency is not that common. Okay, and so first trimester mostly due to hormonal changes, and then the third trimester we say it's because of the pressure of what you call the uterus on the bladder. As the fetus grows up, it's exert its pressure on what you call the bladder, and so you feel to unit. Then we have quickening. So quickening is the perception of fetal movement by the pregnant individual, which may occur between 16 to 20 weeks. So this is also an examinable thing. When to expect quickening? When to expect quickening. So we said quickening is the perception of fetal movement. Okay. We have people who tells you that I feel something is moving in my tummy, and then they will think that is pregnancy. Okay, let's say their cycle has stopped for some months, and then they tend to experience that something is moving in the body or in the tummy. We've all had some people saying that they go and do pregnancy tests and all that, and it says it's not pregnancy. And so, but if it is pregnancy, if it is a pregnancy, we expect that an individual will start experiencing fetal movements, actual fetal movements between 16 to 20 weeks of gestation. That is the week duration within which an individual is expected to experience the perception of the fetus moving. This is dependent on the nature of the pregnancy. And so, for instance, if the person has had gotten pregnant before, okay, had gotten pregnant before, the person is multiparous. When we say multiparous, it means the person has had, multiple pregnancies, right? And so for those individuals, they tend to experience quickening early, okay? And so they will experience quickening around 16 weeks of gestation. But then for someone who is having her first pregnancy, okay, someone who is having her first pregnancy, mostly carried up to this week, what you should expect is that this individual is expected to experience quickening around 20 weeks. And so the question they usually ask is that it's a 20-year-old who is having her first pregnancy calls you and then reports that at 18 weeks of gestation, she hasn't felt the movement of her fetus. What would be the best response? And then you have reports to the emergency department as soon as possible. You have call your healthcare provider. You have continue to monitor or continue to monitor. Continue to monitor. Then you have a different thing. Because this is the person's first pregnancy, what you need to understand is that for people who are having their first pregnancy, mostly carried beyond 22, first pregnancy, they will experience the quickening around 20 weeks. And so it is only after 20 weeks that if the person hasn't felt the movement of the fetus, that is when you ask the person to report to the healthcare provider. For people with what you call, who are having their first pregnancy. But for multiparous, it is mostly around 16 weeks because of the previous pregnancies that they have had. So all that I want you to understand is that it only becomes a problem if after 20 weeks, the person is telling you that after 20 weeks, I haven't had a feel of my fetus moving. That is where it's a cause for concern. If it is not after 20 weeks, there is no cause for concern. You only tell the person to continue monitoring, okay, and then explain to the person that quickening is expected to occur between 16 to 20 weeks. And so if it is not after 20 weeks, you continue to monitor. Okay, that is what I want you to understand regarding quickening and how they ask a question around quickening. Then we have fatigue as well as changes within what they call skin color discoloration, okay, on what we call the abdomen. So changes to skin pigmentation such as linea nigra and that is melasma that occurs. So these are presumptive, and I believe that after here, if you get any question asking for signs of presumptive signs of pregnancy, you are not going to struggle, and then you're going to answer it as easy as that. Any question on the presumptive signs, anything you want to add? Okay, then we talk about probable. So probable signs. And so the probable signs, yes, they also tells that an individual is pregnant, but it is also not conclusive. So it says probable. So in terms of grading, we start grading from presumptive to probable. Okay. Yes, so with probable, the signs of probable or probable signs of pregnancy mostly comes as a result of the growing fetus, right? And so as the fetus grow, the uterus will have to enlarge, expand to accommodate what you call the fetus. Okay, and so these are changes that takes place as the fetus grows. Oh, okay. And so first one we'll talk about is uterine enlargement. And so the uterus has to enlarge to accommodate what you call the fetus as well. As the fetus grows, you expect the uterine lining and then the uterus to also enlarge to accommodate. So uterine enlargement, when you see it in your questions or options and you're asking where it falls, understand that uterine enlargement is a probable sign. Then we have these signs: Higa sign, Goodell sign, and Chadwick's. Okay, now when it comes to these three signs, these probable signs, you have to understand their description or their meaning. And so Higa's sign talks about compressibility and softening of the lower uterine segment that occurs at around 6 weeks of gestation. And so at 6 weeks at week 6 or from week 6 going, when you do your assessment, okay, and then you feel some softening and then some form of compressibility of the lower, uterine segment on assessment. And so most of these things too, you would have to, assess for it to be able to what we call elicit for them. And so Higgins sign is where you have compressibility and then softening of the lower uterine segment. Know the explanation or what it means. The description of Higgins sign is that it happens around 6 weeks of gestation, and it means there is what we call compressibility and then softening of what we call the lower uterine segment. Then we have Giddel. So Giddel's sign is rather softening of the cervix. Okay, softening of the cervix. That will also occur at the beginning of the second month. Okay, at the beginning of the second month, you have what you call softening of the cervix. And so we said Higa is softening of the lower uterine segment and its compressibility. Goodell is softening of the cervix. And then Chadwick's is violet discoloration of the mucous membrane of the cervix, the vagina, and that of the vulva, which also occurs at 6 weeks of gestation or at around 6 weeks of gestation. These are the three signs I want everyone to have it on your fingertips. Higa's sign, a softening of what you call the lower uterine segment. Goodell is softening of the cervix. Then the coloration, violet discoloration talks about Chadwick's. And so Chadwick's violet discoloration of the cervix, the vulva, and that of the vagina. So this is what we all need to know when it comes to the signs. Then we have ballotment, which is rebanding of the finger of what you call, rebanding of the fetus against the examiner's fingers on palpation. And so when you are palpating the abdomen and you can feel that reband tenderness of the fetus against what you call the examiner's finger. Let's say you are doing your assessment and then you can feel that you are palpating the fetal part against your hand. Okay. And so that is that kind of reband tenderness that you feel. It's called ballotiment. And then we have Braxton Hicks contraction. And so if you have been pregnant before, you understand this. When you'll be there and then you are feeling some kind of pain, and so with Braxton Hicks contraction, it is very annoying. Okay, they will tell you that it's very annoying. So an irregular painless contraction that may occur intermittently throughout pregnancy. And so you are there and you are feeling some kind of irregular contractions that is not regular. For a normal contraction, it has to be regular. The one that will lead to cervical dilatation and all that, it has to be regular and progressive. But for Braston-Hicks contraction, it occurs at any point in time and it is not continuous. Okay, and it is very annoying, they will describe to you. So when you have a patient who is around, let's say, 16 weeks of gestation, and the person tells you that I tend to experience what you call some form of irregular, painless contraction, which is annoying in nature, and the options, and they are asking you what is the most appropriate response or education for this client. What you have to understand, you have to let the clients know that Bastron contractions are normal pregnancy sign that the individual will experience, and then when they are experiencing it, they shouldn't be worried about it. Okay. Then you have positive pregnancy tests for determination of HCG. That is why when someone goes to the lab to do UPT, we don't conclude that the UPT is conclusive. Okay, we don't conclude because other things could also cause other things can also cause. Jay, go to mommy, okay? So other things can also cause HCG to be released into the urine or HCG level to go up. And so when you go and test for the urine, you see that the person will have what do you call it will indicate as UPT being positive or pregnancy test positive, but you go and do your other things, findings, and you notice that the person is not pregnant. And so we don't conclude using positive pregnancy tests determination of HCG level. You have to go ahead and do an ultrasound to actually identify the fetal outline before you then did say that this person or this individual is actually pregnant. Okay, so when it comes to positive pregnancy test for determination of what you call HCG level, understand that it is part of what we call probable signs. Okay. Understand that it is part of what you call probable signs of pregnancy. That is on probable sign. Anyone with any input, any question on probable signs, before we talk about the last one, which is positive signs. These are diagnostic.
I have a question.
Okay, madam.
During the Goodwill's signs, can one have abortion or miscarriage?
Can one? So we said that these things happen around 6 weeks of gestation. Yes, and so abortion can happen from even the very first week you notice, if only you can note that you are pregnant and you want to take something to quench it. Yes, so understand that abortion is anything less than 20 weeks. So if you are losing pregnancy before 20 weeks, whether it I don't know whether I am getting the understanding of your question. I don't know though, but because these are signs, okay? Remember, these are just indications that one is pregnant. And so if you let's say lose the pregnancy along the line, you are not going to experience the signs at the end of the day because the pregnancy will no more be there. Because we said that these signs comes about as a result of the uterus growing, sorry, the fetus growing up, and then its effect on the uterine lining and all that, the uterine alignment and its segment. So that is what brings about the signs. So I don't know if your question you asked has been answered. If not, probably you have to reframe the question again so that I understand it better.
Okay. I asked that because I know a woman
Mhm.
that has been carrying pregnancy and then miscarry more times. And then it got to a time she got pregnant. After 6 months, she was okay. And then she started bleeding again. So, and then they were like, it's because her cervix is soft. That is why she
Yes, so that is
miscarried.
cervical insufficiency.
Okay.
So this softening, okay, this softening is different from what is causing the person to
Her
lose
own.
the pregnancy.
Oh, okay.
So
Okay.
these are normal signs that when you are pregnant, you are going to like you are going to have an assessment, or like you are going to experience an assessment. So the softening is not like something that is going to cause the cervix to open up to cause the person to lose the pregnancy. For those with those kind of issues where that is cervical insufficiency, where the cervix is not able to hold the pregnancy up, and so when the fetus grows up, then you see that the cervix tend to open up, and so for those people, they have to even send them in and then do what is the name of the term? They go in and tie the cervix. What is the name of the term? Help me out.
Large.
Uh-huh. Come again. Cerclage, right?
Circlage.
Uh-huh.
That's
Cervical.
They go in and do cervical circulage for them. So they go in and then tie the cervix up so that it can hold the cervix, can hold the pregnancy up to what you call
Circlage.
um, circulage. Cervical circulage. Thank you. Yes. So this is different from that one. That one is just that the cervix is not competent enough, should I put it that way, to be able to hold the pregnancy up to 10. Okay. And so
Okay.
when they do that, you would have to even avoid certain activities. You have to avoid sexual intercourse, you have to avoid any kind of strenuous activity. At times, the woman will have to even remain on bed rest or remain on bed rest for some weeks before the person will be asked to engage in activities. But these are normal signs that if you are pregnant, you should experience for what we are talking today.
Okay.
Any other?
Say,
Yes, hello.
please, I want to ask, is the Braxton Hicks contraction supposed to occur at the first 6 weeks or
Oh,
after the 6 weeks?
no, so that there's no, so you can, that is why it says that it can happen throughout pregnancy. So it can happen, it's something that it can occur even before 6 weeks. And then throughout pregnancy, up to the time that you even attempt gestation, some people attempt gestation, you can still experience what we call this kind of, I mean, contractions that is not progressive enough for you to go. Say that you are coming to give birth. So it's something that can happen at any weeks, and it continues. Even before 6 weeks, up to the person delivers, this kind of contraction can happen at any time. So it's not weak band. Let me put it that way. Braxton Hicks contraction is not weak band. It can happen anytime during the pregnancy. You can feel this kind of movement, and then you think that it's cervical contraction, or your contractions that uterine contraction that is happening. All right. Any question? All right. Let's talk about positive signs. So these are the main things that will tell you that this person is actually pregnant. If you do any of these things and the results comes out to be positive, then it is conclusive that it is pregnancy. So first one is you determining what you call the fetal heart rate. And so when you are able to determine the fetal heart rate, then understand that it is pregnancy, because that is the only thing that can cause you to identify or you to elicit for what you call, or to hear the fetal heart rate. So fetal heart rate detected, you can detect the fetal heart rate using an electronic device or using a Doppler. And so fetal heart rate detected by an electronic device at 10 to 12 weeks, and then by a non-electronic device, that is a fetoscope, at 20 weeks of gestation. So what is the significance of this? The significance of this is that the electronic device, that is the Doppler, can identify the fetal heart rate at 10 to 12 weeks of gestation. But this is the time that when someone is pregnant, by hook or crook, you should be able to identify the fetal heart rate using the Doppler. But we know that the heart, when it comes to, fetal development, after, the embryology stage and all that, and then the fetus is developing, the heart is one of the organs that will start developing early. And so the pacemaker of the heart is what gives us the heartbeat. And so it developed early as part of the organs that has to develop. And so as early as 8 weeks of gestation, you can identify what you call the fetal heart rate can be spotted, or the fetal heart rate can be determined using what we call the electronic device. Okay, so in some questions, they tend to ask the question this way: at what week should you first, try to assess for the fetal heart rate? And so I say that as early as 8 weeks of gestation, you can determine the fetal heart rate using what you call the electronic device, or the Doppler transducer. Then they also tend to ask, at what week should you probably be able to identify what you call the fetal heart rate? And that is at 10th week. And so at 10 weeks of gestation, you should be, the word is probably be able to identify the fetal heart rate. But at 12 weeks of gestation, if only it is pregnancy, then the fetal heart rate, no matter what it is, the fetal heart rate should be able to assess at 12 weeks of gestation. So we start from 8 weeks coming. 8 weeks, you try to assess, but you might be able to pick it at 8 weeks, and then at times you might not be able. Then that comes to 10th week. And so at 10th week, same thing, the probability is also high. But then at 12 weeks of gestation, the fetal heart rate should be able to be spotted, or to be, assessed using the Doppler transducer. And then with what you call your fetoscope, you should be able to use it at 20 weeks. And so understand that at 12 weeks, you cannot be able to use what you call your fetoscope to assess for fetal heart rate at 12 weeks. Okay, so if someone comes and a person is pregnant, and at 12 weeks, you are trying to use the fetoscope to assess the fetal heart rate, you are not going to get the fetal heart rate with the fetoscope at 12 weeks. What you should use is the electronic one, which is the Doppler transducer. So when you are able to do this, assess your fetal heart rate, we term that as positive pregnancy sign. So the positive pregnancy signs are only 3: fetal heart rate assessment, then active fetal movement palpable by the examiner. And so if you are able to palpate active fetal movement actively when the fetus is moving, and then you are able to palpate and know that this is actually what you call fetus I am palpating. And this should be done by an examiner. Okay. And so when you are examining your woman and you are able to palpate the fetal movement, then that is what we call another positive sign. Then the last one is you identifying the outline of what you call the fetus on an ultrasound. Okay, so outline of the fetus identify via either an X-ray, that is radiography, or ultrasonography. And so if a woman is pregnant and the woman is asked to do an ultrasound, and the ultrasound comes out to be to pick the fetal outline or pick the fetus, that is also conclusive that it is pregnant. So these are the only positive signs of pregnancy that in the NCLEX they are going to bring it. They are going to bring it to you. And these are the only ones. I don't know whether anyone has any other positive sign in his or her packet. The person can bring it up for us to look at. But that's just by the way. So when it comes to positive signs, there are three. Fetal heart rate assessment or determination, then palpating the active fetal movement, and then outline of the fetus on an ultrasound. These are the three. Don't let them trick you with positive pregnancy test. Don't be tricked with positive pregnancy test. The moment you hear positive pregnancy test, what they are trying to mean is determining for HCG level, and HCG level is a probable sign. So positive pregnancy test, we usually say that a positive pregnancy test is not a positive sign of pregnancy. I hope you understand this statement. A positive pregnancy test is not a positive sign of pregnancy, because we said a positive sign of pregnancy are three, and these are the ones listed here. Any question, any addition on what I have said so far?
So,
Oh,
sorry.
yeah.
Yeah, please. So the positive pregnancy test is probable sign.
Yes.
Okay. Thank you.
All right. Any question before I also give you my questions?
Hello, sir.
Yes, hello.
Please, I remember during my service, I was
Mm,
asked to assess a pregnant woman. So I was going to do
mm,
the Doppler, use the Doppler on the
mm,
abdomen, and the in charge told me that
mm.
unless she's 16 weeks before you can feel the fetal heart, so I shouldn't use it. I should just let her get up. So I am quite confused about, or the 16 weeks is the Ghana one.
Yeah, but you won't kill me. You said this is Ghana one. We don't have Ghana one. Okay.
Because I know, like
Was it a fetoscope you're going to use or a Doppler?
a Doppler.
Are you sure it was a Doppler?
Yes, please.
A Doppler, that is why I said that even at 8 weeks of gestation, Doppler at a point can identify at 8 weeks. But then the time you should be able to use a Doppler and get the fetal heart rate is 10 to 12 weeks. This is what you should go with. Okay. I don't know what your in charge told you. I mean, and hair rational and all that. But just like I told you, the heart is one of the organs that develops when it comes to fetal. I mean, development. And so at between 10 to 12 weeks, you should be able to use the Doppler. So don't be confused. We are in the NCLEX ward. We are not on the ward. So you are done with service. And so that was service stuff. But we are in the NCLEX ward now. So don't be confused. Okay. After here, you can read more to know what your in charge said was true or not. And what I'm saying here, whether it's true or not. Okay. So we are sticking with our 10 to 12 weeks with our Doppler. Any question? Any addition? All right. I think we can move forward. So these are my questions. These are my questions. The
Sir,
next
please,
is
the last one, the abdominal enlargement is also a
abdominal
probable
enlargement.
sign. Yes.
Yes, it's probable. That is what the uterine enlargement is.
Okay.
We
Okay.
don't say
Thank you.
abdomen, we say uterine enlargement.
All right. Thank you.
It's the uterine enlargement that is causing the abdomen to also grow.
Enlarge. Okay.
And so it's uterine enlargement. It's probable. Haven't you seen people with protruded abdomen and it is not pregnancy? Madam Hamdia, haven't you seen, sorry, in quotes, some women
Yes.
with the abdomen, I
Yes.
mean,
Yes.
big and then it is not pregnancy. So yes,
Yes. It's true.
uterine enlargement alone is not enough for you to say that it is
Okay.
pregnancy.
Okay. Okay. I was thinking,
Okay.
you said, presumptive signs. You were saying that it was what the pregnant woman will tell you that it is. So
Yes.
I was
But
thinking maybe abdominal enlargement. Some women will be walking around, you think they are pregnant, but they are not.
so
So I'm
now
not sure.
you are seeing it.
You have
So
seen it, okay?
so with the uterine enlargement, if the uterus is enlarging, automatically it will be seen in the abdomen, right?
Okay.
The abdomen will also. So I said that most of the probable signs are elicited by you are doing the assessment and you identify it. So if you notice that the person abdomen is enlarging due to uterine enlargement, you can identify it as a nurse or whoever is doing the assessment. I don't know whether you are getting the point. You don't
Yes,
necessarily
sir.
you don't necessarily need a woman to tell you that I have experienced that my uterus is enlarging or there is uterine enlargement. Definitely when it's happened, you cannot hide it. It will be shown. But the other things are things that it is the person who has to tell you that is a presumptive. It is the woman who has to tell you that I am having this before you'll be able to spot it. I don't know whether you are getting the difference here. Okay. So let's look at I have some
Yes,
few
sir.
questions.
I get you. Thank you very much for the
I
explanation.
have these simple questions. They are very simple, not difficult. My questions are always simple. Just once in a while I get um the debatable ones. The nurse is performing an assessment on a client who suspects being pregnant and is checking the client for probable signs of pregnancy. The nurse would assess for which probable signs of pregnancy. It is select all that apply. We just did this. So I expect at least 50 answers. I expect 50 answers in the comment section or the chat box. I expect at least 50 people to respond to this. All right. Yes, so are we answering or we are? So only one person has responded. Hey, are we still thinking through the question? I thought this one there would have been walk over, let's
But
go.
Flamingo, a lot of people have answered, though. A lot.
Hey, and then I'm not
Mm.
seeing
In
from
the
my
chat
end, though.
box, about 15 people have answered.
Hey, I'm not seeing,
Mm-hmm.
oh. Oh, okay, that's not shown. Oh, okay, what's up there? Oh, okay, I see. Thank you. I wasn't seeing. I've now have to scroll up and see. Okay. Okay, someone asked why positive ACG test not a positive sign.
Because
Someone is
some hormonal imbalances can give you false positive for HCV.
So I think I already explained that ACG level can rise not only as a result of pregnancy. Okay, it is hormone, and so you could have other instances where this hormone could be released into the urine, or its level could go up, and then when you go and do the pregnancy test and it comes out to be positive, and you take that alone to be sufficient. Remember, we said the positive signs are conclusive for pregnancy. When you do the positive signs, there's no other thing again for you to do to confirm that it is pregnancy, because those are the confirmatory tests or the confirmatory things that you have to do to be sure that it is pregnancy. But the ACG being positive is not enough, because other things can cause that hormone level, or you could have other problems or other conditions also causing ACG level to rise. And when the level rises and they go do a pregnancy test for that person, you might probably pick a positive test there. Okay, so that is, I think, all right. So someone is giving an example like PID. Okay, that PID could also cause that for what do you call HCG level to even rise. And so that is why. All right, so I a lot of people have answered. So you guys went for 1, 2, 3, 4. Or is there someone with a different answer? So 1 is ballotment, 2 is child risk, 3 is uterine enlargement, 4 is positive pregnancy test. The last 2 are positive signs of pregnancy. Okay. All right. Any any question, any inputs? Okay. Let's look at this question. A pregnant client is a client's pregnancy seen for a regular prenatal visit and tells the nurse about experiencing irregular contractions. The nurse determines that the client is experiencing Braston-Hicks contractions. On the basis of these findings, what nursing action is appropriate? 1 is contact the healthcare provider. 2, instruct the client to maintain bed rest for the remainder of the pregnancy. And the 3 is inform the client that those contractions are common and may occur throughout the pregnancy. Then we have call the maternity unit and inform them that the client will be admitted in a preterm labor condition. All right. Mm-hmm. So we've learned, I spoke about breast enhanced contractions and all that. So I believe this question is very easy. It is expected. So clients should be educated that this is unexpected findings. And so clients shouldn't be worried about it. Okay. All right. Yes, this is another example on how to determine the EED. So let's look at this question. A client arrives at the clinic for the first prenatal assessment. The client tells the nurse that the first day of the last menstrual period was October 19, 2023. Using Nagel's rule, which expected date of delivery would the nurse plan to document in the client's charts? And then we have July 12th, 2024. We have July 26th, 2024. We have August 12th, 2024. Then we have August 26th, 2024. Based on what we learned and the calculations we did, let's answer this quickly. If you don't understand any of the answers we are going through, feel free to bring it up.
Hello, sir. Hello.
Yes, hello, kindly go ahead.
Yes. Sir, please, with the calculations, my network was failing, so I didn't get the calculation.
Okay. Let's finish this. When we finish, we'll go through it.
Please
Okay.
send me
Oh,
too.
okay.
Hajia,
Yes.
Hajia, where were you?
Yeah, I came
Oh,
in.
it's nice though.
Oh, please.
Where were you,
I was
Hajia?
missing. I was in the middle of the sea.
You see, she didn't come
It's at
early.
work. Yes. So
All right, so you will use this one to answer to explain it again. Okay. Yes, so those who are answering, who is taking us through? Those who are
Flamingo,
answering. Yes, hello.
please, my network dropped. The other one, the first question we had, the probable signs. Please, what
Uh-huh.
was the answer that we chose?
And the first four.
The uterine enlargement.
Yes.
But it
Let me
could
see.
be myoma. Okay, it's not a positive sign. Okay.
The question says probable signs.
Because I was thinking that 1, 2, and then 4.
Mm-hmm.
Because the uterine enlargement, I was thinking maybe a myoma or something.
And that's
Okay,
why
so
it's a
it's,
probable sign.
yeah, okay, I get it. Thank you.
The question is probable sign, not positive, eh? The question says probable. So yes, myoma can cause the uterine enlargement.
Okay,
And that
okay,
is why
thank
it
you.
is probable. Yes.
Okay, thank you.
Okay. So this is the question I was asking. Who is answering it for us before we, or kindly bring your answers before I go through to again for those who were not here. So if you want to answer, kindly come up and then answer for us. Tell us how
I
you
want to
arrived at
try.
one.
I
Okay,
was fun. All right.
kindly go
Okay,
ahead.
so the last menstrual period the client said was on the
Mm,
19th of October,
mm,
2023.
mhm.
So I'm using the +7 +9. So
Okay,
+7, and then I'll count the 9 months forward.
forward. Okay.
Yes. So if I'm doing that, the 19th, if I'm counting +9 plus 7 days to the 19th. That will give me 26. So that will be 26. And then 9 months forward from October will be July. So it will enter the following year. So that will be 26th of July 2024. That's how I got it. Thank you.
Thank you. So she had this one. That is the B, sorry. She had the B. She said she had July 26, 2024. And then she used +7 +9. Okay. That is, she added 7 days to the first day of the last menstrual period, which was on 19th. And then she had 26. And then she counted 9 months forward from October. And then that gave her July the following year, which was 2024. Anyone else too? Okay, so who is also using the other method for us, where you have to subtract? Who is going to take us through the subtraction one?
Okay, I'll also do that one.
Okay, so
Yeah, if you subtract, if you add the 7 to the 19, you will get 26.
Okay.
And then if you subtract 3 months from the October, if you count back, subtracting 3 months, you get July, and then you add 1 year to the year, and then you get 2024.
Okay. So I gave 2 ways by which, thank you all, you've all done well, thank you. And all those who answered in the comment section, you've all done well. So I gave, for those who were not here when we're determining the estimated date of delivery using the Nigel's rule. Okay. I said that this rule largely applies to pregnant people with the regular menstrual cycle of 28 days, which of course the question will not actually tell you that it's a regular menstrual, blah, 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 but it will just tell you to determine the EED. And so in determining the EED, we said we use 2 methods. Okay. One, you have to first of all identify the last menstrual period. And remember, I said that the last menstrual period, we don't just take any date at all. You take the first day of the last menstrual period. So, for instance, let's say this question had gone ahead to say that the last menstrual period started on 19th October 2023 and ended on, let's say, 24th, ended on 24th October 2023. And they are asking you to identify, or they are asking you to calculate the estimated date of delivery. We use the first day of the last menstrual period. That is what I want everybody to know. And so the first day of the last menstrual period is 19th. And I said that the first one is add 7 days to the first day of the last menstrual period. The date you get, you put it down. So after we added 7 days to the 19, we had 26. That is 19 plus 7 is 26. That is the day. Then you come to the month. So we said the first one, you first subtract 3 months from that month we are in. So when you take October, you subtract 3 months from October. We all know that October is the 10th month of the year. So 10 minus 3, we are getting 7, and 7 is July, right? Or you can just decide to count. So October, then you start from September, then so September, August, then you go to July, right? So July will be when you are subtracting 3 months. So you subtract 3 months from the month. Then when you subtract, you realize that you still be in that same month. So it says that after subtracting 3 months, then you add 1 year to it. So adding 1 year to 2024 will give you, 2023 will give you 20 24. That is the first one. This is the subtraction. Add 7 days to the first day of the last menstrual period. Subtract 3 months from the month, then add a year. So we subtracted, we got July, we added 7 days, we got 26, and then after adding 1 year, we got 2024. Then the second one is after adding 7 days to the day, we don't subtract, but we rather count 9 months forward. When you count 9 months forward, we don't add the year again because automatically, when you count 9 months forward, it's either it is sending you to the next year or it gives you the correct year in terms of the year. When you are counting 9 months, we don't add the year. So when you are counting, we got October, the month was October. So you count 9 months from October and you arrive at July. So you get July 26, 2024. That is how to determine the estimated date of delivery. There was a hand up. Sefa.
Yeah, Boss Amingo,
Yes, madam.
I saw a question on this Nagel's ruling, and in that question, they didn't give an exact date like this. So the scenario was like a patient reported like pregnancy and said her last menses was like 4 months ago. So, and they were like, today's date, let's say today's date is 8th May. So like 4 months ago. So it's up to you to count
No,
backwards. Do you
no.
get it?
So 4 months ago, any proper question should give you the exact date the person had her last menstrual period. If you can post that question for me to see
So,
in the book.
okay. So when I
Any
went to
proper,
the question, okay.
I'm just telling you
So,
that don't get
okay,
confused. Any proper NCLEX question will give you the
okay,
last days, the first day of the last menstrual period. That is what I want you to understand. Because if they
okay,
are not specific, how then do you know when? That is why practically when someone is pregnant, the healthcare provider want to know. The healthcare provider will ask more. Do you know when you had your last menses? Tell us. Then you tell and they calculate from there. So any proper question has to include the actual date should be included for any proper question.
okay.
Because if they don't give you, it means that they want you to think. And how do you think to know when exactly the person, unless they are telling you that for instance, if let's say they are saying today's date is what, 8th. Let's say
Yes.
the person tells you that I had my last menses that was 4 months ago. And am I going to use the 8th to count my 4 months backwards? No. That's
Yes,
what
the
I'm
question
saying.
I saw, that was how
And so I'm
it was
saying that
done.
that's why I'm saying that any proper English Q bank question has to give
Okay,
you the months and then
okay, thank you.
exact date has to be given. Okay.
Okay,
Any
thank you.
proper question, it has to be included there. Because if they leave it blank for you, it means that you have to go and think and know that, okay, the 4 months. No. It doesn't make sense. It doesn't make sense. Any proper question has to include the date of the last menstrual period. I have not seen a question where they leave it blank for you to tell that, okay, since it is 4 months, it is from now. It doesn't make sense. And all questions I have come across gives you specific dates. Okay. That's why we said that NCLEX doesn't want you to be thinking too much. So don't be thinking too much when you get your questions. Proper questions will be clear for you, clear and straightforward. All right. So don't worry, for your exams, they will be specific with the dates. Okay. Any other questions on this? So yes. So we arrive at B. Those who are not here, do you have any Any question? Got. Okay, so let's look at this. All right. The next is collecting data during an admission. During an admission assessment of a client who is pregnant with twins. The client has a healthy 5-year-old child who was delivered at 38 weeks and tells the nurse that there
We
is
can't
no
see the
history.
screen, no, sir.
Is it all of you?
Then it's from you. We can see.
Kindly check you can leave
Okay, it
quickly
has
and
come.
join.
It has come.
Okay. So let me continue. The client has a healthy 5-year-old child who was delivered at 38 weeks and tells the nurse that there is no history of any type of abortion or fetal demise. Using a GTPAL, what would the nurse document in a client chat? You have it down there. So based on what we went through, let's represent the client information using the GTPAL. Yes, who is answering for us? Who is taking us through?
Hello, sir.
Yes, hello.
Okay. So the answer I chose is two.
Okay.
She's currently pregnant with twins, and twins is counted as one. Then
Mhm,
there is one child, so the gravida will be two. The
mhm,
gravidity will be two.
mhm.
Then the term, since she has one child, which is 5 years, the term is one at 38
Mhm,
weeks. Yeah, so the term
mhm.
is one. Then preterm will be 0. Then abortion 2 will be 0. Then one child is living, which is the 5 years. So L2 will be 1.
Okay. So she went for two and she has explained how she got her answer to be the second one. Is there anyone who is struggling to understand how she arrived at the two?
Yes, please. When I came in, that was when you people were wrapping up the GTPL. Please, I don't understand, please.
Everyone says that she doesn't understand. Okay.
Yes, I don't. I don't understand.
Is it the latecomers? We'll find King for the latecomers. Okay.
Hey.
All right. So, okay. So aside those who came in late, probably before we did this, um, those who came and after we had done this is those who were here when we started. Is there anyone struggling to arrive at the answer our sister has given, or if you are having a different answer to what she has given, you can bring it up before we try going through together, then see what to do. Okay, so I think so we said that we use the GTPA acronym to kind of represent client's obstetric history. Okay, kind of a summary, to give a summary of a client's obstetric history. And I initially gave you the meaning of the terms gravidity and parity. I indicated that gravidity is the total number of pregnancy that a woman had, including the current one. And so if someone is currently pregnant, and then we say the person is gravid at 3, it means that the person has had 2 previous pregnancy, and then currently the person is pregnant. So when you add all together, you are getting 3. Then we said parity is the number of pregnancies that had been carried beyond the week of viability. And we said the week of viability is after 20 weeks. And so anywhere you see G and P, and then something is down there, the G is telling you the number of pregnancies the person had carried, and the P is telling you the number of pregnancies that had been carried beyond what you call 20 weeks of gestation. Okay, and then let's come back to this. And so when you take this GTPA, we said that the G still remains the gravidity. However, the T here stands for term. This is G is gravidity, total number of pregnancy, including the current one. Then T is number of pregnancies that had been carried beyond 10, or that had been born at term gestation. And we said term is pregnancies after 37 weeks. So anything after 37 weeks, if the woman delivers after 37 weeks, that is term. Then we said P is preterm. So preterm is between 20 to 37. So anything between 20 to 37 is considered as preterm. A is abortion or miscarriage. And so abortion or miscarriage is anything less than 20 weeks. So if the pregnancy is less than 20 weeks and the person lost the pregnancy, it is termed as abortion. L is the number of children currently living. And so I said that is where the trick comes in, where you get confused, because you can get the L to be more than the total number of pregnancy, or you can get the L to be less than the total number of pregnancy, depending on the outcome of what you call the pregnancy. So for instance, if the pregnancy was a multiple gestation, that is a twin gestation, and then all of them had been delivered and the children are living, at the end of the day, when you are counting, we count the number of children living individually. Okay, so if it is twin, in terms of gestation, we count it as 1. But when it comes to the number of living, we separate the twins and count them individually. So you could have one pregnancy, which was a twin gestation, and then the number of living being 2. So G will be 1, and then L will be 2. The moment you see that, what should come into your mind is that the pregnancy was what we call a twin gestation. That is why you are having gravidity to be 1, and then the living to be what you call 2. The same thing, you can get the gravidity to be greater than what you call the L. And so for instance, if the person had carried or had had 3 pregnancies, out of the 3 pregnancies, including the current one, she had delivered 2. Out of the 2, 1 had died. And so when 1 died, to be left with only 1 living. And so at the end of the day, you will get the G to be 3, and then the L will be only 1. Meaning that out of the 3 pregnancies, including the current one, only 1 child is living. I'll pick it. So we got this question, and this question says that the client is currently pregnant with twins. And we say with twins, regardless of the nature of what you call the pregnancy, gravidity is counted as one. So that is one pregnancy. Then the history goes on to say that the client has a history, the client has a 5-year-old child who was delivered. So the current pregnant, which is twin, plus the 5-year-old, it means that two. That is two pregnancies. So the G will be 2. That is why G is equal to 2. Then a question goes ahead to say that the 5-year-old was delivered at 38 weeks. And so that is 38 weeks. After 37, we say it is term gestation. And so that means that the term is 1 because this 5-year-old was delivered at 38 weeks. It says the client has no history of any type of abortion. And then yes, the client has no history of abortion, so A will be 0. Since the 5-year-old was born at what you call 38 weeks, it means that preterm also, which is the P, will be 0. And then there is no fetal demise. It means that none of the children had died or the child hasn't died. So the living child is 1. That is why at the end of the day, we had G2, T1, P0, A0, L1. Okay, that is how to determine or to use this to represent a client's history. Wendy, your hand is up.
Yes, sir. So this is the formula for this question. So when do they use the one usually here on the word, maybe para 2, gravida 1, para 2, and those things? Because I was using the P to represent the para.
So I said that you realize that in this question they didn't even mention about the parity, right?
Yeah.
So I said that in your question, if they want to include the parity, you see the P to be 2. If they want the parity to be counted, or they want to indicate the parity, you see the G, P, this P representing parity. Then you see T here, then you see P here, then you see A here before the L. Meaning that in this instance, this one of the P is parity. And so I said that the parity mostly comes after the gravidity. And so when you have the P just after the G, then it means that they are talking about parity here. So you realize that the question we had, it didn't mention about parity. Okay. If the middle P is not there, then it means that they are only the P which is there is talking about preterm birth. Does it make sense?
Yes, I get it now. Thank you.
All right. Any question here? Any addition here? Okay, so I think this is our last question on this. I think so. Yes. So we leave it here today. God willing, tomorrow we'll continue from here. We've done well. So if you have any question, you can bring it up before I leave or before we leave for tomorrow. Any question, any inputs? These are the basis. Any question, any inputs here? Okay. All right. I think we are good to go. So we can drop it here for today, and God willing, tomorrow we'll meet and continue.